No idea is too small. 3 young people in West Michigan are realizing the power of a passion for something.
You know, they set out on a course to really do something with their lives. News 3's Holly Doyle is here with that special report.
Talk about ambitious. It's something that many adults don't even dream of doing. They're bringing technology to developing countries to curb diseases. Sounds unreal, but it's become very much a lifelong mission for 3 young people. They have left home here in West Michigan and are now focused on changing the world. Just outside the busy streets of Boston is one busy young woman. Malini Daniel, a senior at Harvard University, is about to graduate with a degree she helped create. It centers around public health and policy.
I have an opportunity to make a difference.
It all began here in Kalamazoo. While attending the Kalamazoo Area Math and Science Center, Malini began researching AIDS through a mentoring program with Pharmacia, now Pfizer. She was just wondering if medical research might be a good career choice. What she found was a mission in life.
I read one article in particular that was talking about how quite a few researchers currently don't think that an AIDS vaccine is very imminent because of a lot of scientific issues related to mutation rates of the virus.
That was discouraging to her as she was researching AIDS. If not a vaccine, then what? A summer in India. Her heritage brought her here, but the epidemic kept her here. India is second only to South Africa in the number of people living with HIV, about 5.1 million people in 2003. Sex workers, their partners, many of those truck drivers, and drug users make up most of those infected.
I mean, it's really difficult to see. It's hurtful almost.
She worked with an organization that helps those afflicted with HIV. Africa's AIDS problems get a lot of attention, so India's predicament was an eye-opening experience.
It was the first time they'd ever had someone from America come work with them, and they were just so excited that I was there and thought that I could solve all their problems.
And she wanted to, especially realizing the social stigma and treatments they endure.
Because India is such a culturally conservative nation, it's very difficult to talk about issues related to sexuality and drug use. And because of that, a lot of people aren't tested, and they are against the education campaigns that go on, and I mean, it just becomes a much more difficult issue to tackle.
It was then, at just 19, when she says the seed was planted. She went back to India the next summer. It was on this soil, back at Harvard, where her idea really began to grow. She asked a professor for help.
You put in your samples.
PCR machines like this one are what organizations say India lacks most. They analyze specific genes in DNA, therefore can follow mutations in viruses like AIDS, thus advance treatment.
People like us have many of them around and we get rid of them. And
Dr. Shiv Pillai filled her request to donate old PCR machines, as did others. But he provided much more. He gave her a contact in her target community in India. And he gave her a suggestion to become more organized, more legit, form a nonprofit. By this point, she was recruiting a friend from high school, also a Harvard student. And perfect timing, Rocky Walter volunteered at an AIDS clinic at a South Boston hospital.
It definitely exposed me to things that I couldn't have imagined before. It's pretty heart-wrenching.
Also privy to the need from family vacations, Daniel's brother, Sunil.
You see all the poverty and all the homeless people, and it's just kind of horrible to see something like that. You should think that people shouldn't, people should do something about it. You shouldn't be allowed to live like that.
He joined the effort, and as a sophomore at Case Western Reserve University in Cleveland, he added a depth of resources. So these 3, despite their age, decided to embark on not just a mission, but a life path. They formed a nonprofit organization and called it Stride, and they are determined that Stride will have an impact on the world for years to come.
These problems are not things that go away overnight, and if you go into it trying to make things go away overnight, you're very quickly disillusioned.
And this is not a fuzzy vision. These 3 young people are very clear on what they want to do. They've set out on 3 initiatives to address the AIDS epidemic in India. The third looks at a waterborne disease in Kenya. That has an unbelievably simple solution. We're going to talk about what they're doing tonight at 11.
It's so heartening to see young people like that doing all this.
It really is amazing.